Hello and welcome to the Family Birth Center. My name is Dr. Elizabeth Erickson and I'm Chair of Obstetrics and Gynecology here at Maine Medical Center. We want you to know that during this time we are daily monitoring our processes to ensure the health of our patients, our staff, and our communities. We also want you to know that we are continuing to provide excellent care to healthy moms and babies. Finally, during this time, we continue to believe that our hospital is the safest and best place for a mother to deliver.
Hi, I'm one of the nurses on labor and delivery, and we wanted to provide for you a video tour of some of the changes that you can expect when you come to Maine Medical Center. We've had some changes in response to COVID-19, and we want you to feel safe and secure while you're here. When you come to Maine Medical Center, you have a couple of options. You can park in the parking garage, which is here, located next to our hospital. You can park on any level, and the level that is called P8, the 8th level, has the connector that will take you across to the hospital. Another option that you have is to be dropped off at the front main entrance. So those are the best two choices for you to come, unless you need emergency care, for which you can always go to the emergency room if you have any urgent needs. Otherwise, we always recommend that you call your provider before you come to the hospital, and they can give you the best information about where and when to arrive. So let's talk about the visitor policy and how that's changed. You will notice that if you go to mmc.org and click on the red banner that says COVID-19, you will find the most up-to-date visitor policy. This has a lot of information for you, so that way you can be able to prepare yourself before you arrive. When you come in, you will also notice that we have some changes as far as your entry to the hospital, as we screen everyone who comes for any signs or symptoms that we would need to be aware of. So you'll notice that there will be a screening team that will screen everyone individually. Otherwise, you can plan to bring the normal things you were going to bring for labor when you come in from the parking garage or from the main entrance. So bring all your gear that you were planning to bring for labor, your bags, your luggage, etc., and you'll just be met by the team as you come into the hospital. Alright. So after you pass through the screening team, they'll direct you how to get to the Coulomb Family Tower, where we have a security desk to check in. You'll see the security team right there that will check in both you and your partner. So labor and delivery is located on the second floor of the Coulomb Family Tower. We also have the neonatal intensive care unit, our NICU, is located on the 3rd floor, and our postpartum unit, our mother-baby unit, is located on the 4th floor. So here on the 2nd floor, when you come off, you'll be met by an admissions person or by another staff from labor and delivery, where you'll be directed either to our triage area, which is also where we have our OR for our cesarean births. We also have our labor and delivery wing on the other end. So welcome. This is one of our labor, delivery, and recovery rooms here on the 2nd floor. We have lots of space in this room. It's a very spacious suite. So if you want to look around, we have not only a place for a delivery bed, you can labor in this bed. We have for our support person a fold-out sofa here that they can crash on if they want to take a little nap while they are here. They're welcome to do that. We have rocking chairs. We have birth balls that you can sit on throughout the room. You have the freedom of movement throughout labor because we have monitors that are wireless that you can use here in the room, in the tub, in the shower, or even walking in the hallways. Over here we have that tub that I was just talking about. It is very roomy and spacious, so you can relax and really help with a lot of the discomforts of labor. So right now I have the privacy screen tucked away, but we can open this privacy screen to give you a little bit of sense of security and coziness while you're over here if you like. There's a bench here for partners to be alongside you if you like, and there's those birth balls. We also have the bathroom that is once again very spacious. So we have room in here for you to do anything you normally do in the bathroom, but maybe you want to even be in here a little bit longer. Say you want to spend some time in the shower. In the shower, we have a fold-down seat that we can make it nice and cozy. Put some towels on it. You can close the blinds. It gets nice and dim in here. So if you want to spend some time laboring in here, you certainly can do that. Your partner can be in here with you as well. They can man the little hand wand there and help kind of direct that water over your shoulders or over your belly, or you can be in here by yourself and really become nice and cozy. So we have this great space for you, plenty of place for toiletries, things that you bring with you to help you feel luxurious while you're in labor or when you're cleaning up afterwards. So we have all of that room for you. Some folks like to spend time in the bathroom, that's why it's pretty spacious. Meaning just it's a nice enclosed and safe feeling space for some patients. So sometimes they like to spend a little bit more time in it. That's why it's so spacious. That way you can be in there, your partner, your nurse can be alongside you. When it comes time to laboring, there are many different positions that can be really helpful. The nurses here are really helpful in mentioning and bringing up different options that you have for laboring. So we have some examples here, even while if you want to kind of take a look at these yourself while you are here in the room, or your nurse can mention many others that we have that can help, that both incorporate the ball in the water or the bed. This bed that we have has many different positions that it can get into to help you with discomfort, and also when it comes time to pushing, to help you get into a position that is effective for labor and for progressing. So lots of positions here on this, and I'll show you just one of my favorites. We call this the throne position, or a seated position, to where you can actually sit in the bed like it is a chair, but you still have the support. So you can sit in it like normal. Your feet can be here. They can be nice and wide, a nice squatting position, which can feel very good and relaxing, and also very supportive of the labor process. You can also turn around and lean over the back of the bed where your knees are here, like this. You can get up in the bed like this. So there's all kinds of really great positions that you can do in this bed. We can take this lower part away and free up the space. So that way, if you want to get into more of a squatting position, we have little pedals here that can come out. You can put your feet up here, and then we have a squat bar that we can place. So if you're seated up here, it's kind of a little noisy. If it's seated here, you can get into a nice squatting position, or you can do it with the foot of the bed in place, whatever makes you feel comfortable. Your nurses and care team will give you lots of examples. That is just one of the very few examples that can be super helpful in the labor process. I mentioned the monitors that you may be using while you're here. Depending on what your care provider has recommended, you may be on continuous monitoring, which means that we leave these monitors on your belly to listen continuously to the baby's heart rate and to watch the contraction pattern that you may be having. So like when you go to your appointments and we listen to the baby's heartbeat with a little Doppler wand, this uses the same technology. That technology is ultrasound technology. We use little straps or even like a very soft belt to hold this in place, so you can be free to move around the rooms. These are the wireless versions. We have the wired versions, very similar, just that it has a wire on it, which means you would be connected to the monitor here. So that's great if you're going to be relaxing nearby the monitor, and we can charge the batteries. Pretty good battery life on them, but sometimes you just might want to have them nicely charged. So the wires can be very handy for that. This machine in this space here is really going to be the place that your nurse will spend a lot of her time. So we have capability to monitor the baby, monitor mom's vital signs, and have access to her electronic medical record all in this space here. So you'll notice that she'll spend a lot of time here, but you are free to move around the room at your disposal. It's fully free for movement, finding a place that feels comfortable for you. And like I said, you can even walk in the hallway. Over here, finally, we have the warmer. The primary objective of the warmer is just to provide a safe place if we needed to provide any resuscitation to a baby at birth. Very few babies need to be resuscitated, but just like all Boy Scouts and Girl Scouts, we always want to be prepared for anything. So we have every delivery is prepared for resuscitation. So there's a little bit of additional equipment that goes along with this warmer that we prepare before birth. And then if we don't use that equipment, we don't use it. We're happy to do that. The really amazing thing that we can do with this too is this is a scale. So the number one thing we use it for is to weigh the baby, which is always very fun to know about and to share with your friends and family once you know the weight of your little boy or girl and sharing that with them. So this warmer here does provide warming capability for babies when they're here and they're exposed and they're not wrapped up, which is not necessarily our primary usage. Like I said, it's mostly for, or the number one reason we use it is to weigh baby. But we have it, has lots of other functional capabilities should we need them. So there's a little bit of time that baby may spend over here. Otherwise, where baby is going to spend a lot of time on doing skin to skin with the birthing partner if she likes, or anyone else in your support partner if you want to do skin to skin. So we have lots of skin to skin time that can be accomplished here. We talked about a number of the non-medical pain relief things that you can do to assist you with the discomforts of labor, the tub, the shower, sitting around, moving around, wherever you like. We have medical pain relief options as well. Normally we have 3 options. Currently right now, to reduce our infection reasons, we are not offering nitrous oxide, and that's a nationwide recommendation to reduce that risk for spreading of infection. So we do have our medications that we can offer, like a narcotic that can be given either as an injection through an IV or under your skin. We also can utilize an epidural anesthesia to help with labor pain as well. So you can talk with your care team about what you would like to experience with your labor, or any questions that you may have about that, and they can tell you much more about that, and also help guide you in making those decisions if you're unsure. So that's pretty much everything that we have here in the labor room. Lots of little tiny little details that we want to go over though. We have the call light that you can call out to your nurses at any time when you're in the room. We have a fan and lots of other things for comfort. And then really important, we have a refrigerator, which is a great place to store your favorite snacks and beverages that you may bring from home. Folks like to bring in things like their favorite Powerade, coconut water, your favorite tea, whatever you like, and your other snacks that you want. So this refrigerator is for your use while you're here. So that is definitely something that you like, and you can work with your care team as well. We will talk to you about your options for ordering breakfast, lunch, and dinner through our patient kitchen, which we have the capability to order an additional guest tray for your support person while they're here as well. Thank you. So following your birth, you will stay in labor and delivery for a few hours to recover from birth, during which time your nurses will be paying special attention to you and your vital signs and to your baby's vital signs, and assisting you with your baby's first feeding session, whether that's breastfeeding or formula feeding. After you are ready to transition up to your postpartum room, your nurses and the staff will help you gather your things, and you will then transfer up to the 4th floor, which is our mother-baby unit, with you, your baby, and your partner. In this room, you'll see that it is very cozy. We have, once again, a bed for the patient, a sleeper sofa for the partner, and we have a lovely bassinet for baby or babies that will be right here in your room, so that way baby is very close to you. This is on wheels, so it can get really close to wherever you or your partner is sleeping. That way you can be attentive to all the sounds that baby makes throughout the evening and throughout the day, and as you learn how to cue in on the hunger cues that babies have as you're learning to breastfeed. Babies stay with their parents here in the room. We practice what's called rooming in, which means that the babies don't have an assigned place in a nursery or any other place to go other than to be with you and learn how to go through all the adjustments to life in your presence and under your care. During your stay here, babies may need additional screening. Things like their newborn screening, hearing screen, and cardiovascular screen are all things that can be done in your presence or in the newborn observation and procedure area, which is also where babies would go if they have a circumcision. So that is an area that's right here on the 4th floor where you'll be staying. They'll go for a short period of time, and the nurses and care team will discuss with you how that fits into your discharge plan and all the things you need to achieve before you and your baby are ready for discharge. If your baby needs an elevated level of care, we also have the neonatal intensive care unit located on the 3rd floor, and we will definitely help you with coordinating your visits and being with your baby during the time that they are in a separate area from you. While you're here, you have not only the bed and the places to stay and be comfortable, but of course you have a private bathroom. So in here you'll see this is your bathroom for your family. It includes a shower with a beautiful sit-down bench that can fold down, which is always wonderful after birth. It's very luxurious. It's a great idea to bring your own toiletries that you like, especially maybe some super special ones that just kind of celebrate that you've just gone through a tremendous occasion and just celebrate your body and that you've just birthed a beautiful baby and brought that one into the world. While you're here, in addition to bringing toiletries and anything you want to wear while you're here, we have patient gowns, of course, but you may want to wear your own clothes. It's totally your choice. We also have a refrigerator for you for your snacks and drinks. Strongly encourage you to do that because all of our birthing families are up all day, all hours of the day and all hours of the night, and they certainly get hungry just as often. So it's always nice to have additional snacks and treats that you can have throughout the time that you are here, in addition to the meals that are offered through the patient kitchen, your breakfast, lunch, and dinner. So the normal length of stay after birth depends on the type of birth that you've had. So following a vaginal birth, the normal length of stay is 2 nights, with the possibility for early discharge after 1 night. Patients that are eligible for that depend on the time of day they delivered, how the mother is doing, and how baby is doing. And your care team will discuss with you your eligibility for that and if that fits into your needs for your family. And the normal length of stay following a cesarean birth is 3 nights, with an early discharge possibly available after 2 nights, depending on how you are doing following surgery. There are many different things that need to be accomplished in the time that you are recovering after birth, with a number of them being listed here on this great sheet called Homeward Bound. Has lots of information that's super important to achieve before baby is ready to be discharged. This includes bringing in your car seat and having that evaluated by the staff to be sure that it fits your baby. So that's something that during the time that you're transitioning from labor and delivery to the mother-baby unit, it can be a good time for the partner to go to the car and pick up that car seat and bring it to have up here in your postpartum room. So now that you've had a tour of our labor and delivery and our mother-baby units, let's take a minute to talk about how you can prepare to be here. Right now, the policy is that you can have one support person come with you and stay with you continuously while you are here. That means you might need to prepare your household to be away from it for a few days. This includes childcare, pet care, or anything else, as if you were to be going on vacation for a few days and not being able to go home to your household. So we ask that you prepare your support person to have enough of their own belongings to stay here for 3 or 4 more days while you're here. And we also ask that you consider bringing in snacks that both you and your support person may want while you're here. We've already mentioned that you have breakfast, lunch, and dinner, but as you know, you might get hungry other times a day, so definitely bringing in snacks is a good way to go. In addition to having that support person stay with you continuously the entire time, another way that we are asking to help support the health of our community is that in advance of you coming to the hospital, you be very mindful about social distancing. Any visitor that comes to the hospital and is symptomatic will be screened and will be sent to their care provider to be cared for and may not be able to be with you if they are symptomatic. So it's important to have not only a support person selected before you come to the hospital, but maybe even consider having a backup person in case your support person becomes ill. In addition to having the support person and yourself screened when you come to the hospital, to prevent anything from coming into the hospital, it's important to to practice social distancing once you go home. This is in order to protect yourself and your baby and everyone else in your family from any illnesses that may occur in that time period once you're home. While you're here, we have to provide you with a family environment as much as we possibly can. I want to remind you that we have free Wi-Fi, as we always have. So our network is MH Guest. There's no password needed. You can utilize that the entire time you're here for any video chats and phone calls that you want to do with your family. Your family can also be a part of the drop-off team. They can drop off food when you're at home. Again, keeping in mind, no contact is the best way to do that. So dropping it off at your front door, leaving a beautiful note, waving at you through the window, all good ideas before and after you're here in the hospital. Here at Maine Medical Center, we are constantly evaluating the safest way that we can care for you and your family, both before, during, and after your stay. We thank you for your understanding and flexibility. From everyone here at the Family Birth Center, we look forward to caring for you during your stay.